Thank you for joining today's session of Meet the Doc. We have recently received a lot of questions about bunion deformities. Today we're going to spend our time talking about what a bunion is, and we're going to try to dispel some of the myths associated with the surgical correction of bunion deformities. First and foremost, a lot of my patients will ask us whether or not they can wear special shoes or braces or some sorts of splint to try to correct their deformity non-surgically. If we look at this photo, and this is a photo of a very dear patient of mine who was kind enough to create a framed catalog of all of her preoperative and postoperative photos and x-rays. If we look at her preoperative photo, you can see very evidently what the bunion is, and it is this large bump sitting at the base of the big toe. The big toe is angulated in towards the second toe. You may notice that she has multiple hammer toes, which are elevated and curled toes that we'll discuss at another episode. But it is clear from this preoperative photo that no splint is going to be able to realign this metatarsal back in place. The deformity, the bump, is essentially caused by the head of this bone, this first metatarsal, protruding out into the skin. So surgically, what we want to focus on predominantly is realigning this metatarsal back in a straight position, while at the same time bringing the big toe back into a straight position. If we look post-operatively, that is what we've achieved on Brenda. You can see that her first metatarsal is now well aligned and in fact very much parallel to the second metatarsal. You can see the big toe has been brought around. It's no longer angulating towards those smaller digits, and there is no bunion deformity to speak of at this point in time. Once again, preoperatively, very evident that with a bunion of this size, a patient with a similar deformity is really going to be forced to wear very wide or open-toe shoes, which is the only non-surgical treatment for a bunion deformity. Post-operatively, it becomes very clear that the bunion is gone, the big toe is nice and straight, and if you look very closely, you will have a hard time seeing a scar. In our practice at Luetta Foot and Ankle Specialists, we have corrected several thousand bunion deformities, and it's very important to us to not only achieve a great functional outcome, but we strive very hard to achieve the best cosmetic outcome as possible. One of the other myths that we commonly hear when our patients walk in the door for their initial consultation is, oh my God, I have heard horror stories about bunion surgery. I've heard it's excruciating. And what I'm quick to tell them is if they will take the time and talk to some of our postoperative patients, they will quickly learn that our patients don't experience anything of the sort. We, in our practice, utilize every modality that's available to us to minimize or eliminate postoperative pain, not only for our bunion patients, but for all of our surgical patients. If you have a bunion and you'd like to know more about it, or if you are curious about the surgical correction, please give us a call.